Thank you.
I'm putting my pen down. Excellent. So Kevin, we just talked about the agenda that we had all laid out last time, but the thing that we didn't put on there was the board reorg. So last time we had said, if no one brings a motion forward to do the board reorg on that date, then we don't actually have to do it that date and we can defer.
Right.
So now that everyone's here, if you would prefer to defer that till later, we don't have to do the board reorg today. I'm also happy to talk to, I can kind of talk to everybody if you want, just offline and talk about the roles, responsibilities of chair, all those kinds of things too. I was thinking that might be useful.
That'd be really useful, I would say.
Very useful. I did see the meeting minute. I did watch the meeting Thursday rather. So I know what's up. And I just feel like I don't know what I don't know at this point. I've been on this board for two months. I've never been on the policy end of things. I've always been the worker bee. So this is entirely new to me, and I don't feel adequately prepared to take a leadership role. So I'm all for deferring and trying to gather information.
Yep. Okay. Jean, looked like you wanted to say something.
Yeah. So I've looked into this a little bit, and so if you defer the reorg and Eleanor's effective after today resigned, you have a 2-member board with no chair. A two voting member board, 2 voting members, 2 associate members with no chair. The problem that raises is, can the current chair still call a meeting? Because the meetings are posted on behalf of the chair. So like Thursday night's meeting is posted on behalf of Chair Eleanor Shonkoff.
Mm-hmm.
And I don't know if that's still allowed because you won't be the chair on Thursday. So that's one question. And then how would we call meetings to order? Because the chair, assuming that that's okay, and that's just a technicality,
Mm-hmm.
then going forward after the meetings are posted until the 27th of August, without a chair, how do you call meetings?
So it seems like, and Kevin, you might have some insight. It seems like Kevin said last time that a full member it would default to a full member to play that chair's role until an official chair and vice chair were elected, and that the associate members could apply for full membership so that conceivably we could have 3 voting members. And then I don't know which one would default to be the chair. I don't know if it's the one who's been, Carrie, you've been on the board or no, Paula, you've been on the board the longest.
So
My 2 months of experience.
So So I would certainly be willing, Kevin, I know you said, Carrie, you wouldn't like this. I'm willing to be acting chair until we can sort ourselves out. That would be fine. Paula, if you wanted to do that too, I'm absolutely fine with that as well. I'm not.
So the simplest thing I would say to do then, Jean, in this absence is, I think we should have the board vote Carrie as the vice chair to the Board of Health today. And then starting tomorrow, by default, she becomes the chair until we get one.
Yep.
Because that's the role of vice chair is to run the meetings in the absence of a chair.
Absent the chair. Kevin, were you ever a parliamentarian for student government, Kevin? Because you're so good at this.
Yeah, how do you know all this stuff?
I like structure. I'm a type A personality.
Yeah.
I like square things go into square holes. That's how my brain works.
Okay.
So the position of chair will be vacant, but the position of vice chair, and we've had a vice chair in the past, correct?
Yep. Correct, we have.
Okay, sounds good.
So,
Take that
someone
vote.
can make a motion of the three.
I move that Carrie Dunn be vice chair, interim vice chair. Interim?
No, just vice chair.
Vice
Yeah,
Chair.
I'll second. Roll call.
Paula, yes.
Eleanor, yes.
Harry, yes.
And I'm very grateful for this time. It just buys me time
Yeah.
to kind of get up to speed on stuff.
And I think it's good too. It gives us the board time to get a new member on board as well, and we'll see how that works out. So I think it's a good move. Thank you, Carrie, for taking that on.
Of
Now,
course.
I
you.
see
Agreed.
that Dick isn't here. Did he leave us?
I didn't see he was here to begin with.
I saw his face briefly.
Oh,
Wait, are you talking about Rick?
Rick,
Or-
sorry.
Oh,
Rick.
yeah, maybe
Oh.
your screen view changed. He's here. Maybe
Oh,
if
okay.
there's a way to scroll down or something or do gallery view.
Oh,
Maybe when
yeah, I
it's
should do that.
TV. Okay.
I haven't used this computer before because my husband's usually in this office, so I don't. There you are.
Here I am.
So then, speaking of you,
Can I also, I think I CC'd Eleanor on this, decided to take up Kevin's suggestion to request
oh, great.
become a full member as opposed to an associate. But I think that has to be approved by the select board.
Correct. Yeah.
Yes.
So at their next, I think technically you have to go before the VASC as well, but they, we should reach out to, I'm not sure who on. Oh, who is it? No, it's Karen
Karen
and
and
Carlo.
Yeah,
We should
that's
ask
who
them to.
interviewed me.
Yeah, we
That's
should
who-
ask them
yeah.
to do an immediate interview process so it can be before the board on September 9th, the select board on September 9th to vote on.
okay, I can do
Note
that.
that, Mark Doxer had asked for us to not, to hold off on doing things. So I don't know if the town, maybe at command, we could talk to the town manager on how to coordinate with the chair of the select board. If maybe the town manager coordinates with the chair and we make sure everybody's on board of how we're going to do this. Because ideally, if they could do it, even in the same night, right? Sometimes the VASC would meet earlier that same night,
Yep.
vote, and then it would go to the full board, and the full board would vote, and then we could be done, which would be
Mhm.
great.
Is
So
that,
there's one other piece that I need to add to this is I still have not heard about the conflict of interest issue. I did email Bob and
Yeah,
he was going to get back to me, but I haven't heard from him yet.
I think he's working with town council on that.
Okay.
Yeah, I think he's working with town council.
and then kind of going back to the last point, would it be possible for, I'm just thinking of not having a chair, not having a full voting board until September 9th. Do they ever approve things that, outside of a meeting or I think one other idea we had talked about was just calling a select board meeting to approve a member.
So the easiest thing to do is Kerry starting Thursday as the will be the acting chair for all intents and purposes, can elevate Rick as an associate
Right.
member to a full voting member. So you have a 3 voting member board.
Got it.
And you just have to do it every meeting, Kerry, that we're at. It's not like you can't, it doesn't continue. It ends at the end of a meeting kind of deal, but it's pretty
Yeah.
simple to do right at the beginning of the meeting.
Yeah, absolutely.
Awesome.
And there's
We
also,
just need to make sure that Paula is at those meetings to actually have a quorum to start the
To
meeting.
second my motion.
That's the only trick. So Kerry and Paula for the next few weeks,
We're a
I
team.
hate to tell you, but you're on.
Yep.
At least for 5 minutes to start the meeting, and then one of you can bug out again.
Right.
Linda.
To preserve a quorum.
I think once the associate member is elevated to a voting member on this topic, like let's say it's COVID,
On the topic, yes.
then I think it's good.
Oh, okay.
I'm not sure I understand that.
So it's the way that it's worded in the general bylaw, and I can get that for you so you can see it. the way I interpret it is that once a associate member is elevated to be a voting member on a certain topic, like let's say COVID-19, then you don't have to keep reappointing every time you're talking about COVID-19. That's
that's correct. You're 100% correct, Gene, which is fine for the Monday meetings, but Thursday meetings of
Right.
Board of Health, and they're continually
Right.
changing. So we'll just have to,
Yep.
so I guess Thursdays we'll have to just always do it.
Yep.
Unless we're talking about the same topic.
And then that raises the other question about schedule going forward.
Right, I saw the meeting on Thursday, and it looked like there was two things being discussed. One being command going to every other week,
Mm-hmm,
correct?
mm-hmm,
And then alternating people going to command,
mm-hmm.
which would greatly decrease the workload.
Yep.
Yep.
And then there was a issue with the other people who are potential members could not come on Monday mornings. Correct?
Right.
Right.
There
But
was
if
no
we-
daytime availability. There was no daytime availability for the other candidates.
Oh,
That was what
potential
Bob had
candidates,
said.
But that's
So-
less an issue if Rick's now interested in moving up, right?
Correct.
If the
And
stars.
also if we're alternating people going,
Right.
it's less of an issue.
Yep.
Right.
And
They
I
have,
was,
excuse me, sorry, they have no daytime availability at all?
that was
Or just
what,
not-
that was what Bob conveyed. Yeah, I mean, they
Okay.
probably
I
have a
didn't know if it
day
was
job.
just, yeah, no, I just didn't know if it was just that particular day and time or if it was none at all, that's all.
Oh,
don't know.
I thought, yeah,
We don't-
I got the impression it was just Mondays, but
Oh,
I don't
I thought, so we don't know.
Problem was the 10 a.m. time slot.
Ah, okay.
Just on Monday, Jean, or any day?
Well, it was the fact that there were meetings on Monday at 10 a.m. was the problem.
So we're not going to get any further because we're just speculating at this point.
Right.
So we just
Right.
need to wait.
hurry up and wait. Yep.
Nothing more we can do about that, except know that we'll talk about it again when we have more information and can actually make an informed decision.
Yeah.
But it sounds like we have a structure and plan for going forward. And I'll, yeah. So we can talk about that.
Does the board need to vote on the new schedule or want to vote?
Well, I don't
Well-
think, we don't know what it would be.
Yeah, we've never really had to take a formal vote either.
No. Well, I guess what Paula was recapping about the command meeting every other week and then rotating members to attend that is that, I know when we talked about it before it sounded like the board was interested in the weekly command meetings. Is there now interest in every other?
I wonder if because it does seem like we don't quite have enough information. I wonder if when Karen and Carlo do the interviews, I know that previously they were telling candidates what the current schedule was. Maybe they could say, this is the current schedule, but we're anticipating moving to possibly once monthly, Monday morning 10 a.m. meetings and then Thursday night meetings. I guess I'm saying maybe in the interview process, Carlo and Karen could communicate a potential schedule change, given that, so that we wouldn't have to set a schedule right now that might not work for a future member, but that we wouldn't avoid not having a future member because of whatever schedule we set. Does that make sense?
Yes.
Oh, yeah.
It doesn't, yes, it doesn't make any sense to change a schedule before we know whether someone's available, to my mind.
I was thinking that at the command meeting at 11, it isn't on the agenda, but it could be brought up about the command meetings. And if we as a board are willing to say, we've deliberated on this and, we are agreeable to going to every other week on the command meetings and rotating the voting member, the 3 voting members, which would mean each of us, or the 3 voting members would be every 6 weeks, which
Yeah,
is
right.
pretty reasonable,
Yeah.
able to do. And then just, if we can agree to that, then we can present that at 11, it's not on the agenda, but maybe add it at the end and say, we're okay with that, and see what the command group thinks, because it sounded like they were thinking every other week, and it was really us being unsure. But if we're sure, that would also solve the problem for the 3 volunteers, because they would know that they would be associate members, or if they wanted to be a permanent member, they'd have to be part of that rotation.
I think that sounds good. I'm agreeable to that.
And then I think that would mean we would have, we'd have our Thursday night weekly meetings continuing for now. And I think it would mean we wouldn't have a 10 to 11 meeting. Would there be a need to have, I think the only reason we're having this is because of the command. I think that was what the original setup was.
Right.
So yeah, I'm in favor of proposing that today at command.
And I'll make an offer, if the other members are amenable to rotating, that's great, but I was going to offer to be the standing person for a Monday morning command meeting, because I built that into my schedule, so that if that was a barrier for others, I would be willing to what do they say? It's I volunteer as tribute in Hunger Games.
I don't know.
But it doesn't sound like that's going to be an issue. But I would continue to make
That would be great.
So.
I think as long as there's a board member there at the command meetings, whoever, and that would be great. That person could just bring the information to Thursday night and
Right.
and so forth.
Right. Yeah, I am fine with doing that. I'm very comfortable with reporting out from command to regular staff meetings anyways, so that's easy. And like I said, I built it into my schedule, so it's easier to not move that at this point.
Do we have a sense, looking after August 27th, which is the date we're posted until, do you think you're going to need to meet weekly? I mean, we talked about dropping that down. Is it conceivable that in September that might change?
I mean, my original thought was that, and I think some of this is going to come up on the Thursday night meeting, is that, if we could add that additional support to the health department, so admin and then health director, I was seeing that as really what could decrease the meeting frequency for the board, in addition to, adding functionality.
A year ago, or let's say even 18 months ago, how often did the board meet?
Monthly.
Monthly.
Once
Yeah. So I think
a month.
most boards of health in Massachusetts are still meeting around monthly, or maybe twice monthly.
I did look into, and I know we're going to talk about this on Thursday, but I'd like to be able to send this out if it's okay with you guys, about, you talked about regionalizing and a health director. If you stay in the same group of emergency preparedness, you don't have to attend double meetings. So I made a list of all the agents and directors in our emergency preparedness group, if it's okay to send that out.
Wow, great. Yes, I think so. So I think that sounds good. Wait, Paula, I can't hear you. Are you? You're not muted, but. Oh, no. Can others hear you?
No,
Oh,
you didn't hit mute on the keyboard, did you?
Right now,
Oh, now it says mute.
no. Yeah.
that's me.
Yeah. No,
Oh, no.
still can't hear you, Paula.
What happened?
I don't know.
Oh, now we can hear.
Oh,
Maybe you were just,
Turn up
did
your
the volume
volume.
get turned down?
Turn up the volume on your iPad.
yeah,
Yeah, it's a volume thing.
the volume thing. Oh, boy.
That's worse.
Where'd Kevin go?
Be right back.
Okay.
Just getting some water, while we're on a little break.
Okay.
That's fine.
So
Let's see
does
what's
anybody
happening
hear me?
to our people.
Yeah, we can hear you. It's just really quiet.
I don't understand that. I was thinking that once school starts, I'm just worried about the uptick.
Yep.
Yep.
And so that going monthly right now, to me, does not seem like a really good idea.
Mhm.
But something I'd be okay with maybe every other week or something like that until we get through this initial change
Mhm.
and see what happens.
Yeah.
I agree with that.
I think
I
it makes
agree.
sense. I mean, we just need to post the meetings 48 hours in advance. So we don't have to post September meetings right now. I mean, it helps to anticipate what we might want to do and talk about it, but
Yep.
we can
Yeah,
see what happens with.
But we also talked about, though, posting the meetings with specific agenda items so the public could see what the board's going to talk about. We should get back to that model. So, posting out for a month at a time is not a good idea. Now, scheduling a month at a time is a great idea, right? But we should get back to posting 48 hours in advance of meetings with specific agenda items so the public can see what we're discussing or what we're going to.
The problem being that Fridays are the town offices are closed,
Right.
so that
Yeah, so
Monday.
you post on Wednesday, right? In that case, Gene, to
Right.
give 48 hours notice under town hall being open? Or does it matter if town hall's open or not?
No, it does matter. Are you talking about posting for Thursday?
For Monday?
Yes.
For Monday, yeah. It's just the town clerk's office has been inundated. So I have been trying to give more time because with the elections and with all the mail-in voting and everything else, they are
All
completely.
right, we discussed
chaotic.
this.
Yeah.
Yeah, we're gonna keep Mondays as a COVID topic in
COVID,
general. And
right.
Thursdays, we're able to do a little
Thursdays.
bit more. Yeah.
Right. So like
Yeah.
Laura's gonna
Okay.
post for this Thursday. Right, Laura?
So does this Thursday need to be updated, or is this Thursday all set?
Yes, it's the agenda that I'd sent previously, the bullet pointed.
I have a lot of emails from you, so I gotta go, I haven't finished going through them all from the weekend. I apologize if you sent it.
Okay, yep, it's there.
It's there, okay, good.
Yeah.
So
it was
that-
I
the-
know I
it was just the
asked you
same-
on Friday, but I wasn't sure.
Yeah,
So that-
and so I
that really-
resent it then. It was from a week, I think it was the Friday the 7th. So you should have it a couple times.
Okay.
But yeah, let me know if you need me to resend.
So my suggestion would be to post the meetings after command for Thursday to this week, because that will give them an extra day. The deadline for posting is noon tomorrow. So it can't be any later than noon time for the town clerk to receive the posting of the updated agenda
For Monday,
for Thursday.
for Thursday.
For
The
Thursday.
deadline- Got it, right, it's Monday, sorry.
Yeah, tomorrow, no later than tomorrow noon, but remember, the town clerk's office is enormously busy, so that's cutting it real close.
And will be through November.
Yeah,
Right,
my suggestion is to post on Monday for Thursdays.
yeah,
If command is, and we are agreeable to, for Mondays to convert to A, every other week, B, a representative board member there, and that would indicate not a Board of Health meeting.
Right.
correct.
That's a management meeting and doesn't fall under the open meeting rule.
Correct.
So there would
Because
be
you don't
no
have-
need to post.
The issue is whether or not you have a quorum, and if there's only one person going, you don't have a quorum. If you have two going, then you have a quorum.
Right.
You have to post when there's a quorum of a board. It
Yeah.
doesn't matter what type of meeting.
Okay.
So yeah, to Rick's point, we probably just will be posting for Thursday meetings then.
Thursdays. Yep.
If that's the way it works out. Okay. And speaking
And
of
all
agenda
the
items, we
Zoom-
should probably get to a couple of them.
And all the Zooms are all set, so we just need to do the posting. We just need to rewrite the posting with that in there.
Right, update the posting with the agenda. And I think, Jean, did you say through August 27th?
August 27th. Yep.
Okay.
Right. Good.
The 20th and the 27th have to be updated with the detailed agenda. So
Right.
those both need updating.
Great. Okay. So speaking of these agenda items, a couple of them, sorry, Laura, was there another comment? Okay. So the three things that we had put on at the end of our last meeting might be able to just be for command. Carrie, did you have any updated, you were going to go through the list, I think, of things that employers can do if regarding the travel ban, it was like between the 72 hours of testing and when they report to work, there were three different things, like employers could have the employees continue to self-quarantine or to work from home or to submit to another test before returning to work. We had
But
just
those-
decided,
Go ahead.
so that might just be for a command meeting, but we decided at the end of our last meeting to have that as an agenda item for today. So I'm just raising it. Is there any
Yep.
further discussion or do we just want to communicate that at command? Okay.
I don't have anything more. Yeah.
Great. And then we also had on our agenda to touch base again about the reopening protocols for town and any updates there. I haven't heard anything, but I imagine that maybe the town manager can give us updates during command. And Jean, last time you had said that he communicated this at the department head meeting. So I don't have any updated status on that either. Okay, so that can be for command. And then the third thing that we had said was the enforcement issue. And again, this is probably for command, whether or not there were any updates either coming from the governor or that the police chief might know from communicating with either the governor or others who've been trying to implement this, whether or not there are updates about the enforcement issue for COVID-related violations. Last time we had talked about, after having received some information from town council, would we actually want to make a motion to use the fee structure that we've used or fine structure that we've used with the pesticide regulation for any COVID related issues, which was the first offense would be education, like providing a copy of the relevant guidance or order. The second, I think, was $50, and the third and continuing were $100.
Mhm.
So it seemed that we were all in agreement with that, but we didn't have a vote. There was no formal motion.
Because it's a jointly held responsibility with public safety. So we wanted to confer with, we needed to confer with them, make sure that we're on the same page before there could be any forward movement.
Great.
Can I ask
so-
Laura a question? Laura?
Yep.
Which one?
Hi.
Is Laura Gem on?
Yeah,
No,
she just
oh, she
arrived.
is now.
Oh, yeah.
No. Laura V, how have you been in the situation with the COVID since the pandemic that you have had several complaints with the same people or that find if we had this in place that you would have used it?
No.
Okay.
What about the fact that you had received numerous comments, I remember, about plexiglass in one of the grocery stores being taken down? I mean, it seems in those cases you went to investigate and it wasn't actually the case. The plexiglass was still up when you went to investigate, but it did seem like that we had received multiple complaints.
Right, but I wouldn't give them a ticket if the plexiglass was really there.
And multiple complaints is different than multiple times offended.
Right. So
Right.
multiple violations is what we.
Right.
I personally wouldn't feel comfortable giving somebody a ticket, nor do I think it's right to give someone a ticket just because there was a complaint, even though it was unfounded.
No, of course
Oh,
not.
of course not. Yeah, of course not.
We all Right, we all agree with that.
Right. Yeah. So
It's just- Right. in the
was
case
there
of
multiple complaints? Yes. Was there multiple complaints where I would have issued a ticket? No.
Okay.
That's good.
Yeah, it will be good
But we
to,
already have ticket books.
Oh, so
And
you'd
before
be the
sending-
person, you'd be the person issuing the tickets?
It's either,
I can
it's
issue
the local health departments and the police is what the governor's
So
latest
both.
order was.
Mhm.
Both have the authority to do so.
Okay.
That's why we wanted to talk to the chief to say,
Okay.
how do you want to handle this?
Yep. I understand now.
um, so another thing I just wanted to bring up. So our cases are still small. It looks like there was an additional increase. And one thing I just wanted to bring up to the board is that I know, and Carrie, you know this too, and Laura has been on the DPH calls, that the last I heard, there's not a specific number of increased cases at which you would call Department of Public Health. If there was any reason to either scale back on opening or anything like that, the response was sort of from DPH, we'll know it when we see it. So if in your community you see cases continuing to increase, then call DPH and have a conversation with them. And at that point, they can decide what they would recommend moving forward. So we just haven't, as a board, talked about, is there a certain number of cases, or at what point would we decide to call Department of Public Health? Or is it more about the rate, if we see the rate increasing very quickly rather than the absolute number of cases? It's just, I think, something to consider moving forward so that there's not a delay. Like if board members are getting the information every Wednesday, you know, and Laura and I have talked about this too, and that she would, if it seems like the cases are continuing to increase, that she would talk to the chair before the following Wednesday. But it might be useful to have a conversation about, you know, moving forward, at what point do you call DPH? Does that make sense?
So if we did see just, I mean, the cases going up, to me, you can't look at those things on paper. You have to look at those things in real time. Where are the cases going up? What's the demographic? Is it school because it was in one cohort in the same all subsection of that cohort? You know, so there's a lot of, I think, variables that go into whether we think it's increasing widespread or we think it was a pocket. So that's important to take in. But what exactly, let's say we had that, what exactly would we be calling DPH for?
To say, look, we've got this cohort, should we, I mean, the conversation I'm referring to was in one of those meetings that you call into, and DPH said, if you have a concern and think you need to maybe return to a prior phase of opening, call DPH. We'll talk about what you're seeing in your community and make a decision with you about whether we would recommend also moving to the previous phase.
Got it.
But they said sort of, we don't have hard and fast numbers or rates or anything. So
No.
call and discuss it when you see it.
And I think it's because it's not something that you can look out on paper. That's probably why they're being very leery about saying, you know, giving you a
Right.
set number or percentage, right?
Yeah.
'Cause, again, it could be a small subgroup that it's like, okay, this makes sense why all these folks got it.
Yes.
You know, they're in and around each other. You know, it could be that type of scenario where I don't think that's a big issue. If you're seeing people that are getting it that have no relation to one another on a large subsect, that's completely different.
Right.
Right. So we had the 4, I don't know if there's anything similar about the 4 cases that we have now in terms of where we think they were exposed, or if they're all the same ages. I don't know, Laura, if you have any,
And 2 or 3 of them were still, I think, leftover, right? Still trying to work off the list. Laura, is that correct? Laura V?
Hold on. What do you mean trying to work off the list?
Wasn't there a couple of folks that were still on there that were not new cases, but they were remaining cases from previous month? Or is that not correct?
well, we got down to 1.
No,
And
Okay.
then,
I've got,
Over the
they're new as of 7/21. So 7/21,
Okay.
8/3, 8/3, and 8/12.
Okay.
But
And are there any relation of those folks, or is it just, you know, random across the board?
The only information I have is their ages. I would have to ask Elise because 3 of them are hers actually, but they're just totally different ages and not related.
Okay. I think it'd be important to let the nurses know moving forward that the information as the people start to come onto the list is important for us, or at least for you folks to kind of compile a little bit to see if there is any commonality. Does that make sense, Laura?
I don't know if they can do that because unless they're like, they have to be at something specific and it would have to come up specific because I don't think there is a.
Obviously, household is easy to compile.
Right,
If it's from the
yep.
same nursing facility, that's easy to compile. If
Correct.
it's school age kids, maybe there's a way we can look into when schools open. If the school age kids, maybe there's a way we can look into what cohorts they're in and what subgroups they're in each cohort.
So how was the cluster identified before? It was just each contact tracer. If there were, for example, multiple contact tracers, did they have any regular meeting where they said, "Ooh, I just got a case at this nursing facility," and the other says, "Oh, so did I," and then at that point they defined a cluster?
Are you talking about in Reading?
Yeah, I'm just thinking about how in the past did we locate the cluster that we saw, and moving forward, what?
One nurse was assigned specifically to that particular nursing home, and they took all that calls, all the nursing home calls for that particular location, so they knew exactly how many were at that nursing home.
So if 2 different nurses hypothetically were assigned to different cases, there's not a systematic, like regular meeting where they would compare notes.
They all talk
To
normally
potentially-
by, yeah, they all talk normally. I'm not involved in that level of, but they talk every day as far as like what they have. But if it's like a family, so like if you got it, then, you know, let's say Mary was following you. Then Mary would say, okay, and who have you been in contact with? And then you would say like Miles and the blah, blah, blah. And then she would contact each one. So as they popped up, they would come on. But if Christine was following me, and then I would give her who I was in contact with, and she would follow all those. So if it's in an individual basis like that, but when it's in a nursing home, whoever was doing that one, and then if they came up on a different day, they would be in contact so that they knew. But somehow, even though they came up on different days, the nurses figured it out that one person took the particular nursing home. I don't know how or why they figured it out that way. They just did it.
Okay. And maybe
Would it
that,
make sense to have Christine and Elise at a future meeting
Sure.
I would
so we
like
can
that.
game plan how, you know,
Thursday?
how the board would like to handle it?
Thursday night?
I know Elisa's got some time off scheduled, but I don't remember exactly.
Yeah, maybe just find out it's not, and I don't think anything you have to do immediately, but in the next week or so, certainly. It'd be good. So maybe see what their schedules are and if they have flexible time or not on one of these.
okay. Any final thoughts or questions about that one? Nope. Okay. Let's see. Oh, so this is sort of in anticipation of Thursday. I was just, given that today is my last day as chair, I was thinking of anything in advance for Thursday. And I wanted to make sure that we had talked last time about HR maybe providing some information about roles. And I don't know if HR had any chance to provide additional input on a health director or other type of role. And then Laura Vlasic, and you and Dan, I think we're going to provide some additional information about what a health specific admin assistant, what types of roles that person might perform. So just wanted to make sure that could be prepared in advance of this coming Thursday's meeting. And related to that, I'm
sorry, go back for 1 second. What did you just say you wanted? What an admin can perform?
Yeah, any specific roles that a health admin would perform that's sort of related. So one example you've given in the past was that filing complaints takes some training. And so it would be useful for a health specific admin. And so I was asking for a description, made kind of like a bullet pointed list of what roles a health
Okay.
admin would perform.
Okay.
And then I'm sorry, Gina, I've been meaning to circle back about this, but we had a long time ago talked about posting a part-time nurse position, and that is now posted. I don't know whether there have been any applications, but given the upcoming meeting on Thursday to talk about master plan and moving forward, I didn't know whether or not the board wanted to keep that posting active or maybe remove the posting and then reserve that 30,000 for a potential contract or contracting out with a health director role.
You can't use that. The 30,000 is in the salary budget.
Mm-hmm.
So it has to go for salaries. It wouldn't be, you can't take salary money and use it as expense.
Right.
So it would need to be hiring a part-time health director, and the sharing that Laura had just said that we could do, the regional sharing, you're saying that would have to come out of a different type of fund?
When we
That's
regional,
expense items. Yeah.
yeah, when it's any kind of outsourcing, it's an expense.
Okay.
So when we had the regional arrangements with Melrose and Wakefield, we shared a health director. That was an expense.
An expense. Okay. So the salary could only be
I
used.
wasn't saying you should go regional, just for the record, that you guys said you had discussed as a board about going regional. So I was just trying to help by giving you a list of people that are in our emergency preparedness group. So if you do go regional, you don't have to double the work by going to multiple emergency preparedness meetings, and you could keep it in one group.
That makes sense. Thank you for that clarification. Could the salary? Oh,
Can I just clarify something? I'm not remembering a discussion about regionalizing directoring, and can somebody point me to that so I can get back up to speed?
well, maybe it wasn't made very clear, which would have been my fault. We had talked about hiring a health director. This was
Yep.
sort of in the longer term plans, and then given an urgency, if before we would actually hire our own, Reading would hire their own health director, if we could in the interim share functionality with a town that's comparable and already has a health director before we could actually find a person to fulfill that role in Reading, it might make sense to sort of share with another town that has that functionality currently.
I
Does
see.
that make sense?
And as I explained, the health director and the health agent are usually the same thing. So out of our 3B group, 3 of them were labeled as actual health agents. So I don't know if those would be good for you, but directors were only Andover, Linfield, and Wilmington, where North Reading, and Methuen go by an agent instead of a director.
Okay. Thank you. Are there remaining questions about that?
Thank you for clarifying. I guess I missed that piece. Yeah.
I probably didn't make it very clear. And then, Jean, sorry, just at one point, for the salary, could that be used for an admin assistant?
I guess it's going back to what I sent around, I think last week, which was the paying class chart.
Yep.
Those are the positions that exist that you can choose from.
Mm-hmm.
It has to be something on the paying class chart.
Mm-hmm.
The health director position is not on that chart.
So it would have to be added. But the.
So that would
but
have to go
an
through
admin
town meeting.
Right.
But an admin assistant is on,
There's generic admin assistants. Yep.
so that 30,000.
We have someone already as part of the admin staff that I think is available to do the Zoom recording minutes. So that's where we're at right now.
So
Okay.
if we wanted more service than just the minutes,
Yeah.
is that person also available? Are there available hours beyond that, doing the minutes piece?
I think what the best way to figure this out is to identify what tasks the board is looking for. And then I can go back and figure out what kind of capacity we have already existing.
Right.
So that ties
Is
back
this
into
someone
what,
sorry,
go ahead, Laura.
is it someone we already have existing? Or will we be hiring someone?
That's what we're discussing. Do we have the capacity currently, or does this really? Depending,
No, I thought you said we had somebody right now that we could use for part of it or some of it, or we were trying to figure out how much time it would take. Is there someone that we can roll into it now?
that's the minutes piece, yeah.
And so
The
maybe
further piece,
pending,
the further piece to that is depending on, Laura, what you and Daniel come up with for items that you feel an admin role could take off your plate as well.
Well,
So then
I think
Jean can go
Yeah.
back and see if this person can handle it, and if not, then we need to hire outside. Does that make sense to you?
yeah, I think, well, the minutes are huge. When can the person start with the minutes, or do we have to wait for everything before we can even get to the minutes?
Starting today.
It started today.
We announced that at the beginning of the meeting.
I'm sorry?
I said, we announced that at the beginning of the meeting, that starting today, the admin's going to be working off the tape.
Oh, I didn't know that.
Yep.
Yeah, they're not on the call, but they can work off the tape and watch it back and compile minutes that way.
Oh, great. I was wondering who was taking minutes. I thought I missed it at the beginning. So perfect.
No?
Yep.
So we just need that list from you and Daniel to figure out the admin, if it's in-house or out-house, depending on on what you guys come up with for, these would be great items to take off of our plate. So we can be out in the field more, or, doing more health related items.
Yeah, I'll work on that today.
So Laura's going to make a list of things that the health staff needs for admin support. And then is the board going to make a list as well?
I have a list, Emmy and I have a list of what the roles chair has been performing. So that, so we have that, we could submit that, but then if
That
there
would be great.
are, Jean, if there are other roles that you see, or Rick had suggested last time that maybe HR additionally could maybe look at different, I don't know if they would look at different job descriptions and add any more to that list.
So the, any of the hiring decisions, the department head would put a request in, and that gets vetted between the town manager and HR. Town manager is the hiring authority. So I guess the only other concern I would express is that the last time we talked about that 30,000, I think we talked about using it for the nursing position that we've posted.
Mm-hmm.
So now the question becomes, if there's more staffing needed, where would the funding come from?
Well, maybe I wasn't clear again earlier. I was thinking that the board was going to discuss the nursing position and whether or not to post it, given our conversation about the potential reuse of that money in either one of these capacities. But given that it is posted, I didn't know whether or not whether anyone had applied and whether we might consider removing that posting so that we could reserve that 30,000 in salary for any other roles that this board would think would be a better use of that money.
I think that should be probably something we should discuss with Elise and Christine as well,
Mm-hmm.
to get a better feel for, is this something that you think would be helpful? Something that you think would be, not to, for lack of a better term, a waste of resources. I think you have to talk to the folks that it's going to affect, right? In order to see if it's something that's useful or not.
Mhm.
Maybe we can put that on 2 items for them for next time we have them on.
Yeah,
But in the meantime,
yeah, I agree with you, Kevin. I just checked the schedule and Elise is scheduled out the 20th and the 27th. So I would think that it would be a September Thursday.
so that begs the question, have we had anyone apply?
Not the last time I checked, which was last Thursday.
Oh, Paul, we can't hear you. Oh no, now you've frozen. Well, she's frozen. The only other thing I had on the agenda today was just to catch up on meeting minutes. And so I know Jean and Laura, you have a list of meeting minutes and we're not sure who took them. So if maybe you all could circulate that to the board, we could get up to speed there. And I should be current with the exception of 2. Oh, back. Okay, great. Paula, you're back. We hear you. Oh,
Nope.
Again. And Eleanor, do you still have, you and I had a joint minutes that I still have in my books that you started and I finished. There was a command meeting one
okay.
back in May.
Okay.
I can actually
It
probably
might
tell you.
it might be on the list. So
Okay.
Jean and Laura have a spreadsheet of the minutes, and then I updated which ones I had, and then there's some notes in there about Anne Marie took these, Carrie took these, Kevin took these, and then there were some where we didn't know. So if they can forward that to you, you can look at that and see if you can find it.
Okay.
Okay,
good.
Paul, we see you again. Thank you. Did you have a follow-up comment about that posting?
Oh, voice is out.
I don't know.
Oh,
Oh,
we
there
heard
it is.
that. Do you want to type it in the chat?
You can hear the keyboard.
Ask the host to give you permission to record.
Oh, well, now we hear your voice.
So my point was that I know in the past, the nursing position has been a shared position. I don't know if that has any impact on any decisions to be made, just an FYI.
You mean shared with another town?
Yes.
Okay.
That-
We
that's
currently
when-
have,
Yeah, that's when it was a regional. Yeah, when we were regional, we shared a nurse, but that was the only time in the
Yeah.
11 years that I've been here.
So
And
maybe
right
it
now we
makes
have
sense to
part-
keep we can say maybe it makes sense to keep the posting up with the caveat, Jean, just hold off on the actual hiring until we can maybe figure out that piece.
Yeah, I think we were saying that this was going to be an on-call position.
Right.
So for me, it always felt like a good idea to have somebody on call if it was needed. That was kind of how I was imagining, and I think that's how we discussed it.
yeah, it is. Yeah.
And then there was some further discussion of whether or not we were going to avail ourselves of the contact tracing collaborative unit
Yep.
as the resource, especially in light of the fact that it's a little difficult to find public health nurses right now. So if we were to use the CTC, then we might have less need for that on-call nursing position.
Correct.
Are there any final comments before we turn it over to command? No? All right. Take it away, Chief Burns.
Okay, thank you. Good morning, everybody. Just, we have a few things to go over this morning, and I wanted to start with on status of scheduled events in the community, and just get an update from the town clerk on the ballot mailing and the mail-in voting process. Laura, could you give us an update of where you are with it, when the ballots went out and when you think they're going to be delivered, that type of a thing? Would that be appropriate?
You're muted, Laura. Still muted.
It's probably a good thing I was muted, because I said, would this be a good time to joke around and say I'm not sending any out? I was joking. Okay, so the status of where we are with the ballots, we have already sent out just over 5,000 ballots. We probably have another 5,000 to go. We're sending them out at the end of every day. I'm going to Woburn Post Office and dropping them off and sending them out as quickly as we can. We need help getting them out. The problem is getting being able to keep everybody, have somebody coming into town hall and keeping them 6 feet apart and distanced and having a place to put them and that sort of thing. But I need volunteers to come and help us so that we can get them out. The goal is to have the remainder of them done by Wednesday. It takes approximately 10 minutes to send out one ballot. By the time, because we have to process it in the state system, we have to then put everything together, put our labels on, put our stamps on, make sure we have the correct ballot, process it stating that it got mailed out, and then send it out. So it's a lengthy process, but we're plugging along.
Laura, just a question for you. We did have people that said that they'd like to volunteer to help us with things that are related to COVID. If we could get you some volunteers, how many would you like to have? Because they would need to be trained, I imagine.
It's just a matter of somebody sitting with them for a few minutes to tell them how to process it, and then I'm swearing them in. Which I just now realized I have a couple in the select board room right now that haven't been sworn in. As many as we can get. What I'm trying to do is have 4 in the conference room, 4 in the select board room, and then I can put a couple out in the hallway here and there. Right now, Jane Wellman is in her office with her daughter, and they're working in their office. So, we're separating people out that way. Yep. There's her daughter helping out right there. And that's the kind of thing we need to do, is get some just kind of as many as you can get.
Okay.
For the next couple of days.
Do they have to be over 18?
No.
Okay.
They have to just be willing to be sworn in as an election staff member.
Okay.
Laura, when they do come in, how much time are you looking for from people? Is it a half?
I'm pretty much telling everybody whatever they can provide. We've been here all of last week, over the weekend, and all of this week. We've been here from 8:30 in the morning until approximately 10:30 at night. So whatever is available, whatever time they have to give.
And how would you like it to happen from here? If there are volunteers, should they reach out to you by phone or email and ask for time to come in?
Yes. So part of the issue is that, for example, yesterday I processed 200 emails of people wanting to help out or ask questions. Part of the problem is I'm doing the job that they should be doing, so I'm not responding to the emails and the phone calls. So today I'm concentrating on the emails and the phone calls and responding back to them. But they need to be persistent. If I don't respond, then they need to be persistent to help out and get in here. trying to get back to them as soon as possible.
A question then, Laura. Did you reach out to Matt at all from our previous conversation?
Yes.
Matt was the one during the
Yep.
structure that was doing the volunteers.
Yep.
I provided her that list.
Yep.
Paul.
Okay. All right. And
Yeah.
that still should be the structure that we follow. That if we're looking for more volunteers, then Matt has the experience in order to funnel those volunteers back to where we need them. That'd be my suggestion.
Well, so here's part of the issue too, and I'm not, no disrespect intended to anyone, but every election is like this, and for the last 10 years, every election has been done where I just do what I need to do to get the job done, and to try and include command to be able to get volunteers in is an extra step that adds more time. So I appreciate that, the help, and I appreciate the fact of why command needs to be involved, but I need to get this done because I'm the one that's going to go to jail if these ballots don't go out. And I'm being totally serious. So I'm not, I can contact the people that are on that list, but as far as the volunteers that I'm bringing in, I can't go through command to get them in here. I'm sorry.
Well, we're not asking you to do that. What we're saying is we think we can get you volunteers and send them to you.
Well, that I apologize, and I'm all for that. Sorry.
Would it help if someone, probably Matt, did the outreach? In other words, not only does he have the list, but instead of handing you the list, actually go through the list and and set people up and set appointments.
Yeah, that's the way it should work, is that we identify people who are willing to do it and send those people to Laura, so she doesn't have to answer and explain the hours and things like that.
Yeah, I could do that unless they've already been contacted and said, no, we sent the list last week. So I could try to, even if they have, I could try to reach out to them again. But there hasn't been, a whole lot of people, chomping at the bit to come and do this. We've asked for even our own employees to come and help, and we haven't got a great response. So, we'll do the best we can, but we can't make people come in.
Yeah, well, we'll kick it to planning because I think the schools would probably have some people that are interested in it. So I think we can help Laura out by getting us some people.
Okay.
So we'll take a look at that and see what we can do.
Okay.
Okay. So some of the other concerns too is that there's been questions about not receiving the ballots. Well, part of the reasoning behind that is the ballots haven't been sent. But the one thing that we have found, we're starting to get ballots back already. So what's happening is that when we, at the end of every day, we take the ballots to the post office in Woburn, that the normal processing is that anything that gets mailed out from Reading goes to Woburn, then to Boston, back to Woburn, and then to Reading. Well, with the ballots, if we take them directly to the Woburn post office, they come right directly back to Reading. They don't go through that routing process. So they're getting mailed pretty quickly. Any ballot that's being mailed outside of Reading is put aside to be processed immediately. So the post office has been very cooperative in getting them out. And judging from the number of ballots that we've gotten back already, the people are receiving them that have been sent out. We just need to get them out of here.
Okay.
Question for Jane and Matt. Are there resources that are working at Town Hall that could be redirected to be helping Laura? Not as a voluntary basis, but as part of work responsibility.
We have one right now that works in the town manager's office, is in there now helping stuff ballots. And then we have somebody from the collector's office has volunteered to do that, and Jane Wellman has also volunteered to do some too. But a lot of these departments and divisions are already short-staffed because of the COVID stuff. The issue is getting people to be willing to be here in Town Hall to do it. In the library, Amy has volunteered some of her staff as well. She's going to work on getting some of her staff redirected from the library to over here. So, you know,
It sounds like this is a push in the next few days, right?
we have to have the ballots out by Wednesday,
Okay, so,
or somebody's going to be bailing me out.
yeah, so,
I got bail money.
Is,
yeah.
is there,
Sorry, go ahead, Eleanor.
I'm just trying to think if there's any way, I'm thinking, what I can do? Is there anything that can be done? Does everything have to happen in town hall? Like, can I come pick something? Okay.
Yeah, I've actually had a lot of people offer that, but because it's ballots, I can't let them out of town hall.
Okay.
Yeah. So, unfortunately, it has to be done here.
Okay. And the process is that we just, I don't want to be another person calling you, but for anyone who's interested, is there what would we need to do to help?
So what I'm telling everybody is, if you're available, come on in. If you would like to give us a call ahead of time to make sure that we have a seat to put you, give us a call, but let us know that you're coming and we'll let you in the building. And you know, we're, like I said, we're here from 8:30 until about 10:30 at night every day.
Okay.
So whatever time people have.
Pretty much. Yep.
Go to town
Yep.
hall. Okay. And you don't
Yep.
have to call.
No,
Okay.
just to get in.
And not to be a pain, Laura, but we have masks on and hand sanitizer on a regular basis down there for those folks stuffing ballots.
We have hand sanitizer all over the building, but I haven't, there's none in the conference room, but I can put some in there.
There
Probably a
are
good idea to
dispensers
have
all
that.
over the building.
I just, the point is more to just make sure they're doing it throughout the day.
So as the timing gets tighter and tighter, is this something that we should get an update on tomorrow as well? I mean, it sounds like we need all hands on deck to get this done the next few days, period.
Well, in reality, we needed all hands on deck last week.
But we can't deal with that. What we can deal with is the next day or so.
Yep.
And I'm wondering what else. So we got to start coming. I need to sign some stuff. I'll give you a call. I'll come in and I'll spend some time. But we need more people.
Yep.
But I'm wondering, you know, tomorrow, if things are still not done, we need to figure out a way to reach out more strongly, and this has to get done. It just has to. So I think we kind of need a plan B behind this also.
Can we post on the town website?
Yeah, I think what we're gonna, after this meeting, we'll have some, we'll work through planning to get the word out via the town's website and other methods to get that website out. We'll identify a phone number, an email account for the stuff to go to. And then we'll get names in. We'll ask Dr. Doherty if he has a list of kids that may be willing to volunteer for volunteer hours. I think that's going to be a kind of a good area for us to get people in. So I think those avenues, I think we can do something fairly quickly.
Saturday, it was either Friday or Saturday, we had a student in here from the National Honor Society putting in community service hours. You know, if we can get some of those kids, they're really excited to be able to put the hours in to doing it. So communicating to them, and I don't mind signing off on the community service hours that they're putting in. You know,
Go ahead.
what
Sorry.
needs to be I'm sorry, what needs to be realized is that, you know, other communities are sending out, have 5,000, 10,000 requests, which is fine. They're sending out 10,000 ballots. We're sending out 20,000 ballots. We have 2 elections on the same day, and as I said, it takes about 10 minutes per ballot. So I mean, in stopping to field calls and
Right.
you know, requests is not helping.
Right.
That's just me griping. Sorry.
No, but I think it helps us know how to be efficient. So, you know, as a resident, can I post on Facebook, you know, go to town hall, wear PPE between 8 a.m. and 10:30 p.m. You need to be willing to be sworn in. And then do I say call when you get there?
Just call. Yes. Yeah. Cause we have to let them in.
Okay, great. Thank you.
Laura, just a question. Does a So it's all happening at town hall, so there's a physical limitation of how many people you can have at one particular time.
So I'm thinking, so I'm putting 4 in the community room, I'm sorry, in the conference room, 4 in the select board room, and I can put 2 out in the hallway and keep everybody so that I can have 10 max. And then,
Yeah.
like, for example, I put Jane's daughter in Jane's office.
Yeah.
And then I have an extra desk here in the clerk's office, so we can have up to 12 people.
Okay. So you want to have 12 people, volunteers from 8:30 to 10:30.
Pretty much.
Paul
Yep.
Jackson will have that for you by 2:30 this afternoon. Right, Paul?
Well, if we have room for 12 people and we have how many right now? 5, 6?
There's 3, 4, 5, 6, 7, 8 in here in the building now.
Okay, so we have a need for 4 additional today. And then whatever we have to fill for tomorrow. My concern is if we put sort of something on the Facebook page or on the website that says, hey, we need election workers to get ballots out, we're going to create create a confidence problem.
That's a very good point, because the
Mhm.
security of the ballots, yes.
Yeah.
And that's why, typically when we do something like this, I put out a message to the election staff, and I've
Yeah.
got plenty of help, and I just let them come in and come and go as their hours allow. And that's what I'm trying to do here. We need to kind of keep it limited to specific groups. And that's a good point, Eleanor. It's probably not a good idea to put that out on Facebook.
Okay. Yeah, I think if we did a targeted, I know you had some volunteer lists. I'm happy to call people. If we have the National Honor Society kids, my daughter's in National Honor Society, she's here doing this. We can get some of those kids, we can call them up and ask them directly if there's groups of those volunteers that want to help. I know we have a number from that list from before, the COVID list with those folks called in, that we can kind of curate. And I can help take that off your plate, Laura, so that you're not pushing out calls. That's something that we can do internally here. Because I'm concerned that you're being taken from essential duties trying to manage personnel.
Well, that's typically how that's pretty much what I usually do, is I manage all of that and then let everybody else do the work, but it's not working that way right now.
It's just, there's a heavy lift right now. So we can work on some of that offline, but I think that folks who have volunteer resources who are willing to come in, that's the case. And we're limiting the number of people who can be here because of the virus. So there are some safety precautions that are already inherent in your process.
Right.
It's not, we can't have, 40 people come to the door and manage it. So.
And just to be clear, there has been people that have volunteered to do this, and I just haven't had a chance to get back to them. So my plan for today is to get back to all of them and get them in here for the next couple days. And if we can keep a full level of the 12 people over the next couple days, we'll get this done.
Yeah. And it goes pretty quickly. It does take 10 minutes per ballot, but with the process, it moves right along.
Right.
So
How many of the processing? What is it? Just processing quickly? I'm gonna text message with a group of Boy Scouts. That's why I'm asking.
So it's a matter of just taking and putting everything together. You have to take there's 3 envelopes involved. You have to put the labels on, you have to put the stamp on, make sure you have the correct ballot, put all that together, seal the ballot. And that's the part that they're working on. The part that we have others doing is entering them into the state system, because we cannot mail it until it's entered into the state system. So that's the part that takes so long. And it's probably not quite 10 minutes for each ballot. Haven't timed it. I'm just kind of guesstimating that by the time everybody touches it and it gets into the state system, it's quite a little bit of time consuming. So it's tedious work, but what ends up happening is they get into this room and they get into a group and they get into a rhythm and they get into a process and they get to chatting and they have the music going and they're having a good time. And then we have, it's all good.
Yeah.
But if the Boy Scouts want to come in as part of a project for a time, that would be very helpful.
Yeah, I'm gonna try and work on that. It's one aspect that we're trying to work on. Doc,
Okay.
do you have any of the other group that worked with us on the masks?
I can work with Kate to see if we've got anyone available.
Please.
I can tell you that the kids, once it's hard to get the teenagers in here, but once we get them in here, they have a good time with it.
And I think we need to have put together a schedule. So identify people and then the hours that they're going to work. And so it's all covered for Laura.
You can do that.
Okay. So we'll work on that, Laura. Not bother you, but get you people.
Thank you very much. Very much appreciate that. And while we're talking about that too, as far as the staffing on election day, I'm not quite sure where we are with that. To be honest with you, I'm more concerned about early voting. Hopefully by the end of the day, I'll have an answer as to where we are. I'm going through all the emails to get the responses that people have said, whether or not they'll work, and I'll pretty much know where we are.
Okay.
So when is the next time that command is meeting?
Maybe next week. I'm not exactly sure right now. So
what I mean, I intended on sending out an update to the select board after this meeting. I'll send it to the select board because quite a few of them have been asking. I'll include Bob and you in that email.
Okay.
And it'll have a little bit more of an idea about where we are for staffing on election day and early voting.
Okay.
And I'll put that update out. And, at that point, the whole select board will know what's going on.
Okay. Very good.
And then there was one other, as far as events, community events, I believe Bob may have sent you an email on August 22nd. I'm required by law to have, it's the last day to register to vote for September 1st, and I'm required by law to have voter registration open 4 to 6, and let me think again. 2 to 4 and then 6 to 8. I'm required to be open. 2 to 4, we're going to hold the voter registration at the Reading Public Library because early voting will be open at that same time. We'll just do both events at that same place.
Yeah.
The 6 to 8, is going to be here at Town Hall, and it's just going to be a matter of me sitting outside waiting for people to show up, or somebody to be sitting outside waiting for people to show up.
Okay.
On the last day of voter registration during regular times, in 10 years, I've had 2 people show up on the last day of voter registration, and we're always open until 8 o'clock. So, and that's no exaggeration. We have very few people taking advantage of that. I'm not expecting anybody to show up the 6 to 8 time period, so I'm not going to do a whole lot except for set up a table outside so I can work outside while I'm sitting there waiting.
Okay. So you don't need any help with it because you're not anticipating any kind of a demand.
No.
Okay.
Nope.
Okay. That sounds good. All right. Okay. Anything else on voting, Laura?
Get your ballots back quickly.
Okay.
Now I
'Cause
drop off at town hall, right?
So the thing is that after we get these ballots out, we have to process them before early voting starts on the 22nd. So, the demand will still continue on because we have to have the data file updated that the ballots have been returned before we can open early voting polls to make sure we know who voted already.
Is it possible to go ahead and sign people up who are signing up now to help with stuffing ballots, to schedule them a time to help process the ballots after they've been received?
So with to a point, because the part that needs to be processed into the system has to be done by staff. We can't have volunteers doing that.
Okay.
Once we update it in the system and then we decide how we're going to process them for election day, then I might need some help with that. But I think we're just going to, because we have an option to fully process the ballots before election day if we have the staff to do it. But I think I'm going to just wait until election day and just process them all at the same time, because we're not going to have a whole lot of voters showing up on election day.
Okay.
There's not many left. They've all requested mail-in ballots. So,
Okay.
it'll give them something to do.
Okay. Thanks.
Okay. Did that take care of all your concerns, Mark? You're muted.
The one remaining question is in terms of how to return. I know that US mail is an option. The box outside of town hall, I believe, is an option. As time gets closer to the election, is there a preference? Do we want to encourage people to go to the box by town hall? Do you have a preference, and what's the best way to manage that?
So, I don't have a preference, and to be honest with you, I don't think I can legally have a preference. I think I have to give the voters an option to do whatever they want to do, either mail it or put it in that box. It's up to the voters as to how they want to return it, and how they feel comfortable. I can tell you that the box out in the parking lot is going to be starting Saturday, will be emptied it's always emptied every morning, but during this period of time, starting today, we'll be emptying it every day 2 or 3 times, because as people start putting those ballots in, it starts filling up. So the reason why I point that out is because there's no concern about the box being filled.
Great.
We'll be emptying it constantly.
Great. I hear you in terms of not being able to make a recommendation, but if people are starting to, let's say, receive their ballots later or even request them toward the deadline.
We suggest that they put it in the box.
Okay. And you can just drive by to it and just put it into the box.
Yep.
And that's a preference.
Yep. And then also too, and this is something that's not really known, or not something we really want to make publicly known, but as you walk in the town hall parking lot, there's the box that's out on the building that's being used for donations, gift cards. Some folks have dropped their ballot in there, and we are checking that daily too, to make sure that we get it. That's not something we want to advertise, because that's not what the box is for, but I just want to make sure that everybody knows that we are checking that box in case some ballots are put in there.
And the correct box is one that's in the parking lot. Is that right? Because I know there's also a mailbox right there too.
Yeah, you don't want to put them in there.
Okay,
it's the silver box with the white top, and then I'm going to go out today and put a sign on there saying ballots accepted here.
Awesome, thank you.
Perfect. And then what outbound communication should happen? So I know, Laura, you mentioned you're going to send a note to the full select board, which is great. What's the outbound communication we should send to the community in terms of kind of, here's where we are, here are kind of the next steps, make sure, we can reinforce the deadlines. But I think that enough people are asking questions. We run RCTV now, obviously, but it probably is worth having some kind of outbound communication. And so I think, obviously, here we are at command.
So, as far as what should be communicated to the public is that we have I can give you an exact number in the update too that I sent to you. We have processed I would like them to be aware that we have processed approximately 5,000 ballots, and that's a total of both the recall and the primary, and that we have probably more than double that to continue to process. That we will continue processing them, and that the hope is that they will be done out in the mailbox by the end of the day Wednesday. So that because the biggest questions that we're getting is, when can we expect the ballot? Well, if everything continues to go the way it is, and we are done by the end of the day Wednesday, that means every ballot that has been sent will be received by Friday, because the post office is sending them immediately right back to Reading. So, I think that is important to communicate to them. And And then also communicate to them also that they have the option of early voting starting on the 22nd. And those hours were, Jane just posted on social media and our website, the hours for the early voting for September.
So it sounds like maybe the website can just be updated with a little bit more information, but the core contents, remains. Here are the deadlines. Here are the options for early voting.
The deadlines are already on the website. The options for early voting is on the website. Everything is there.
Yeah,
Okay.
it's been up
So-
for a while.
Yep. So the two remaining questions are one, if people haven't yet received their ballots, what they should do and when. So in other words, for example, if they haven't received it by Friday, should they contact the clerk's office? That's question one.
Definitely. Because at that point, if they haven't received it, we need to make sure, one, that we sent it. And then two, if they haven't received it, we can send a second ballot.
Okay. So is Friday the right date that you'd like to use for that?
Sure.
Okay.
Yes.
So that's by Friday.
Friday's mail. Like,
By Friday's mail,
Friday's
yes.
mail. Right.
Yep.
So if your mail comes at 4:00, don't call at 9 in the morning, right?
Right, exactly.
So Friday
And
Friday's
we
mail.
will be here Friday, and somebody will be here Friday and Saturday answering calls, even though town halls typically, somebody will be here answering them.
Okay. So that's for folks who've already requested a ballot or who do so before Wednesday, let's say. The deadline for actually requesting a mail-in ballot is at the 26th.
Correct.
Okay. Is there guidance if people are on the late side of things, what to do?
You mean
as far as getting it, well, let's assume that they receive it, but getting it back to you. And I know this comes back to the question before of encouraging people to use the box at town hall. If
So
that's
dur-
the approach.
Yeah, during a typical election, anybody that requests what's referred to as an absentee ballot, because that's mailed to them, we always suggest that they return it in the box itself. The other option is that the ballot can be returned on election day. So they have up until 8 p.m. of election day to return it to us. And one thing that should probably be made known is that on election day, we check the box outside around 7:30. Anything that's put in there after 7:30, we probably will not get. So in other words, if you're going to return the ballot between 7:30 and 8 o'clock, you should do that at the field house.
So I'm wondering what we can share now of all this information. It sounds like there probably will need to be an update during this week of some sort, either Wednesday that everything is pushed out, Friday if there are, or Saturday or Monday if there are issues. I'm just thinking that it maybe we need some communication before the next command meeting, and just to make sure that we have a system in place to do that.
Okay.
On how to communicate, how the ballots need to be dropped back off, Mark?
Yeah, to make sure everyone understands what their options are. I know the deadlines are there, but this is more, I think, the logistics side of things, just to make sure that if you're receiving your information, let's say next week,
Yeah.
that there's a preference to, you can put it in the box. And in fact, that's a good way to make sure it's received. Maybe that's a gentler way of saying that's a good place to put your ballot.
Mm-hmm.
So, yeah, we just update everything with, you've done mail-in voting, what are my options for returning my ballot? And what are those deadlines?
Yep, that would be great.
So they could go find that information.
That would be great. And then I think the other thing is just what Laura said, that by people should receive their ballots. If they've requested a mail-in ballot, they should receive it by end of day Friday. If they haven't, they should contact the clerk's office and have the information for that, so that there's a possibility of replacing the ballot or whatever the process is going to be. So in other words, people know what to do. If you receive their ballot, here's what you do. If you haven't received your ballot but requested one, here's what you do.
So there's another option too, that the Secretary of State has a website that you can go in called Track My Ballot. You can go to that website and track and see exactly where your ballot is when it was mailed. If you go to the readingma.gov website and then go to the elections page under departments, there's a link to the Secretary's website. When you click on that link, it'll take you to, there's several different choices there, and one of them is Track My Ballot. And then it'll show you whether or not it's been mailed out.
So I'm on the town website. Sorry, I went to early voting details. That's the wrong place to have gone.
Nope, you want to go to departments and elections, or there's an elections button right there on the front page.
Okay, I've got the elections button.
And then you see this button that says, it's like white with the mass seal.
Yeah.
You
Do you
click
want me
on
to share?
that.
You want me to share this page?
Sure.
Oops, sorry, that's the wrong one. That's the agenda.
Yeah, see
Okay.
where it says Massachusetts Rigid? Yeah, so click on that.
Okay.
And then,
Check registration information.
no, it was right there. There was a button that said Track My Ballot. All right, I'm gonna have to get the link on there for Track My Ballot. Go to under elections and voting.
Track My Ballot. Here it is.
There you go. All right, I'll update the link on our website. Good to go directly to that.
Great. Thank you.
So that's also a way to find out whether or not the ballot has actually been sent and when. It'll give the date as to when it was sent out.
I think that might be a lot of peace of mind for people.
Well, we can actually push that out too with our communications. So that link, like I pushed out a link last week for folks to check their voter registration status with the information on when they can register to vote. So we can throw out the Track My Ballot link too. People can look at that.
I'll put the Track My Ballot right on the front of the elections page, and then we can you can go from there with that.
Perfect.
Excellent. Thank you.
All right. Thank you, Laura.
Thanks,
Thank you
Laura.
for all your help.
Hang in there.
Yeah.
Let us know what else we can do to help.
Thanks. All
Good
right.
luck, Laura.
All right. I'm gonna bug out. Okay.
Yes. Yep.
All right. You guys
We
have a great day.
You can
Thank
leave,
you
but
too.
don't bug out.
All right.
All righty. Next up, was looking at the goals and updating our goals. And in the past, we've had a number of goals, and as we've completed and achieved them, we've removed them from our list. So it kind of messed up the numbering, but I wanted to kind of step back and look at what we've been doing and what we need to do going forward. And I've always looked at this as that we've always approached it from the standpoint of, guiding principles, that we want to protect the health of residents and protect the health of employees and assist residents that are in need, help businesses get back on their feet. And so I developed a list of goals that I brought around that I'll share my screen with so you can see. I've got so much open here. I'm sorry. Can you see that? Yeah, okay. So these are the goals that I'd like us to move to. And so they're more general, but what we do is we place the items underneath it. So if we look at goal 3, I'm sorry, goal 4. If we look at goal 3, provide aid and assistance to residents in need, we put underneath that, develop a plan to get the elder services van in operation.
Mhm.
Or we distribute food, assist people with shopping. And then goal under 2, protect the health of employees, install Lexan shields at public windows, provide Lexan shields between desks that are a certain distance apart. So these are broad goals. They will always remain. And then we put things underneath them, and the items, the objectives will come and go. But the objectives that go underneath the goals, assist us in meeting that larger goal. And so we're talking about voting, that comes under community events. So as we move beyond the voting, then that item will come off. Does that all make sense to everybody? Okay.
Greg, just a quick question.
Yep.
If there were some business specific needs, for example, at one point, there was PPE that was needed by certain groups, businesses, where would you put that in terms of one of these goals? I just want to make sure it's covered.
Yep. So that could be under the goal to assist residents and businesses recover. Under goal 7, assist residents and business recover. Or it could be under, if we're providing PPE, we're probably going to put it under protect the health of residents, because we're distributing PPE for somebody. Yeah.
Thank you.
And that's how we did it before when we were distributing it to the elderly care facilities that didn't have it. That was to protect those residents and the employees' health of those establishments. So
great.
Yep. And yeah, we can always add to this. So you can always add goals and remove it. But I think it helps us stay focused that when we talk about goal 2 doesn't change. That it's always goal 2. So I'll remove this from the screen as soon as I can figure out how to do it.
Stop share is the button you want.
Yeah. I'm just trying to get the my screen is minimized on me.
Because you weren't going to be here, how, do you think? Oh, yeah. I'm thinking like 1 or 3:45.
Just bear with me while I try to get that.
That's fine.
Gene could probably block you if need be.
Yeah, that might be because it's not. I don't see it down here at the bottom. The button for that. I'm sorry, everybody. Gene, you want to just block me?
Top of your screen, Greg.
Yeah, I've got the 4 things at the top of the screen: hide thumbnail video, show small active speaker video, show thumbnail video, and then the gallery view one. But
if you hover your mouse below at the bottom of your screen, does a new menu pop up?
No.
No.
I'm sure it's operator error.
Yeah, Gene, what you might be able to do too is go to under sharing advanced options, make it so that only you can share for a moment, and then that'll close Greg out, and then you can go back to allow others to share. There you go.
Okay. Thank you for helping me through that.
Oh, they got you at the 7 a.m. lesson tomorrow.
So is those goals make sense to everybody? And okay, good. Thank you. And as we go forward, again, we can always add, change, tweak wording, things like that. But I think it's a kind of a good place to get us focused again as we go forward. The third item up on the agenda was under PPE. I just want to let everybody know we received a large shipment of PPE from the Massachusetts Emergency Management Agency last week. We received 200 safety goggles, 1,500 face shields, over 15,000 filtering masks, just under 15,000 KN95 masks, 864 pairs of nitrile gloves, and then also 500 infectious waste bags. So all that will go into our storage of PPE that's available for the community. So going forward, so we're stockpiling it for whether it be needed for the schools, whether it be needed for employees, or if we get into another point again and we have to assist our elder care facilities, we still have some. So we're still receiving PPE and keeping it on hand.
Greg, what's the time period that we expect that will last for? Is that several months supply? Is it 1 month, 6 months? I know it's a hard question. What's the expectation though?
It's a hard question. I did it just for the fire department going forward at the pace that we were at back in April, and I filed a grant with FEMA for that because there was a grant program just for fire departments, and it was like $40,000 or $50,000 worth of equipment. So I'm not. I can't give you an answer on how long I think this would last. I know facilities has a good breakdown of what we have in stock because we have a lot of material in stock. And the concern, we needed to have a lot for the schools, for the kids, because they're just going to go through a lot of masks just because we know how it's just the way it is. And we want to make sure we had a lot on hand for that. So we'll try to get you an answer for that the next time, Mark. I can't tell you right off the top of my head.
I'm just wondering, for John and Gail, do you guys have an anticipated need given the plan you have in place now, and how big of a pull would that be against these numbers?
So, Mark, the schools purchased PPE at the end of last year. We've also put in for grant funding as well. So I'm excited to hear that Chief Burns received all of that. That wasn't factored into any of our numbers. We did purchase, I want to say we probably purchased well over 400,000 masks ourselves. We also purchased the KN95s, face shields, and gowns. I think if I were to say where I think we did request additional grant funding, we definitely will probably need gowns, and the KN95 masks is where I think we would probably run into a shortfall, as well as the face shields. But I will say that facilities has been great, and I know the fire department has also been great with helping us out if we run short while we're waiting for orders to come in. But I think for us, unfortunately, the proof will be in the pudding when school starts. We built all of our numbers off of DESE guidelines. Where that will come out is sort of anybody's guess right now to say how many children will show up without masks, how quickly they'll go through them, how many staff members are requesting accommodations for the KN95 versus the regular. So we're tracking what we have, but we're cautiously optimistic.
So as a starting point for the reopening, it sounds like
we have enough for the first day of school.
First day, right.
Day, great.
We're actually hopeful that for the surgical type masks, the gloves, originally the KN95s that we had purchased enough to get us through the entire school year is what we had done. I think, again, where the gowns will be depending upon how many get utilized, and the face shields.
Thanks.
Then, any more on that subject? Okay, we'll jump to the last item, residents that need assistance. Jean, we haven't heard anything for the residents that need assistance. Are you getting any information that there's a gap out there that we're not addressing?
I'm not aware of any, no. I think that the Elder Human Services staff is still proactively reaching out and making those connections, and I think we're hearing that people are okay.
Okay. Anything on that subject? Anything that anybody would like to bring up that we haven't addressed?
Oh, go ahead.
I was just going to ask, in terms of the general plan for the election, I think we kind of referred to it a little bit last week, that I know it's at least in progress, if not in place. Can we have an update on that, the status of that in terms of the queuing that's going to take place? I know that there's a staffing plan. I think Christine mentioned that Officer Scouten had a plan that he was putting together as well. I just wanted to make sure that that's all moving forward.
So for the day of voting, you mean traffic plan, things like that?
Yes.
That's all.
Outside and inside.
Yeah.
That plan is done, completed, it's been updated. We had a meeting with Laura on that. The voting booths are being moved on a particular day, being set up on certain days, all that squared away.
Okay. And you folks are comfortable, Laura's comfortable, that's all on track.
Better yet, Laura's comfortable. That's all we need. Laura's comfortable.
Great. Thank you.
I hate to add more things at the very end of this meeting, but the Board of Health had talked about 4 items where we were either updating command or wanted input from command. A couple of them are pretty quick. Chief Burns, last time you had asked about the potential to meet less frequently with command, that the Board of Health would meet less frequently with command. We talked about that today and are agreeable to going to every other week, to having command meet every other week. And then we would rotate 1 board member in per meeting.
Okay.
So as of today, I think I've told everyone here. So my last meeting is now. So we will have a new board member at that point. So we haven't set any schedule, but that's our thinking moving forward, that we would be rotating Board of Health members into command.
Okay.
That we could go to the 1 meeting every other week. And then the second item was that Bob had wanted to know more about options that employers have in terms of the travel ban, and if employees were going to be returning to work after the 72 hours but within the time that they had tested 70, and then 72 hours would be returning to work. But Carrie was the board member who found out about that, and I don't know if it would work for her to communicate directly with Bob on that, since he's not on the call, and then he would communicate that to department heads. Does that sound like a good?
Yeah, it does. Yeah.
Okay. Okay. And then so related to that, so we had also talked about the reopening protocols. It seems like Bob had communicated that to department heads, and then we wanted to let everyone know that Board of Health is happy to answer any questions about that, and didn't know when we might expect to see any protocols or anything. So happy to answer questions.
Okay. Yeah, I know the checklists and things we discussed at department heads meeting. So right now that's with Bob on the reopening package. So he was working on that.
And then the last thing is after one of the recent governor's orders, in addition to health inspectors, now police can enforce COVID violations or respond to COVID complaints. So the board had considered implementing a fee structure that we have that we had proposed for pesticide regulation, which is essentially the first violation would be education. The person would receive a copy of the order or guidance that had been violated. The second offense would be $50 fine. The third offense and continuing ones would be $100 fine. But we didn't vote on that because we wanted to talk to Chief Clark and see what additional information they had found out and basically work to figure out the best way to have a plan for enforcement moving forward, given that both health inspectors and police are now enforcing these.
So, Ellen, I just got back from vacation. I'm going through about 1,000 emails because I made a point of not checking them during vacation. I'm still waiting from guidance from Mass Chiefs. Last we got, they're not encouraging ticketing. They're encouraging education from the police. So I'm still waiting for some guidance from Mass Chiefs about that and how they expect us to follow it. So I'm just trying to see if there's an email in here from them with any updates on this since the governor put this out.
We could put this on to our Board of Health agenda for next, or whoever is the chair at that point might then revisit this next Monday at the command meeting. Does that sound like a plan?
Yeah, hopefully we have something out on that. We just basically, when orders come out, stuff from the district attorneys come out, Mass Chief puts out with the district attorney how we're going to handle things. We're just kind of waiting for some of that to come out. Now, it could be in one of these millions of emails. I'm still trying to scan through, but that's what we're looking for right now.
Okay.
It's probably important to point out too, there has not been a need to actually implement any ticketing in town, which is good.
Yeah, and ticketing, honestly, I'm more a fan of an education enforcement as far as just hammering people. That's just kind of how my philosophy is. I think people learn more from education than they do from tickets, but it's something, if there was a constant issue, then we might look to do something. It's a case-by-case basis.
Yeah, and Chief,
and that's what we're proposing. Yep.
Chief, just to add on, I mean, our proposal is much in line in the same thing, that the first offense is about education, because enforcement for us is about compliance, not punishment.
Yep.
But that if there were repeat offenses, there are mechanisms in place to use other means of encouragement. So that's all. But yeah, that was our expectation too. Education first.
Yeah, we've always been on the same page with this stuff anyway, so I think we're all looking at the same thing. Biggest thing is about educating the public. What tools we have to do that, we can kind of work through and everything. But yeah, I think we're all on the same page with this.
Great. Thank you, and welcome back.
Thank you.
So that was it. That was all that, unless I forgot anything from other board members. Was that all? Okay. Great. That was it, Chief Burns.
Okay, that's all I had. And I just want to thank you again, Eleanor, for doing such a great job. Appreciated working with you, and thank you. I know it was a lot of time.
Thank you. I have loved it and have appreciated working with all of you all. So
thank you.
Thank you.
I'm not going far. I think I'm going into town hall tonight to stuff ballots. So you're not rid of me yet.
Just a question, if just following up on Laura's needs. So system in place sounds great, encouraging everything. If tomorrow we're in kind of a dire situation, or I guess Wednesday as well, how should that communication flow? Should Laura reach out to you? What's the kind of the process if we're in a really tough spot as we get to the deadline?
Well, what I'd like to see, Mark, is planning put together. There's 12 that Laura has a capacity of 12 people from 8:30 to 10:30, that we fill that for her, and maybe have some alternates that if people don't show, that we could go to, because we'd want to have capacity, 12 people capacity all the way through this. And so I see it as identifying people who are willing to do it, but also plugging them into slots. So that's kind of what we'll talk about. Planning we'll be looking at is who can we get, and then what slots are they willing to fill?
And to clarify, Mark, when I said everything was all set and lined up, I was speaking more to the voting aspect of it, the moving parts, the booths going in and all that. Not what Laura brought up today. Today was the first I heard of the ongoing things that she does yearly anyways. It's just she needs additional help. So we'll work toward seeing what we can pull off, what miracles. That guy in planning evidently is going to be busy.
We got plenty of time till 2:30 to get
Yeah.
this squared away.
Well, we appreciate that guy's working on it.
That's right.
And Mark, we'll make this a top priority, you know, within town hall as well. Obviously, it's gonna get done. It needs to get done. So we're on top of it. And I'll communicate with Bob and you if any issues come up. But, you know, we're sort of all hands on deck at this point.
Thanks, Matt. Perfect.
Anything else? All right, well, thank you, everybody. We'll,
Thanks, all.
we'll get going on the voting.
Yeah. See you in the stuffing rooms.
Good. Do we have a motion to adjourn?
Motion to adjourn.
I'll second. Roll call.
Paula, yes.
Carrie, yes.
Eleanor, yes.
Take
It's been a
care,
pleasure.
everyone.
Hey, Eleanor. Thank you.
Eleanor, we're gonna still wrap up all these emails, right? You're not just gonna leave
Yes.
now? Okay,
Emails
'cause we got a
and
lot of
minutes.
things pending.
Email. Yes.
And I put out the agenda for Thursday. Thank you.
Awesome. Thank
He still
you.
has
Thank
until
you.
11:59.
I'm gonna make use of all of it.
All right. See you all Thursday.
All right.
Thank you.
Good night.
Bye-bye.
Thank you all. Thanks,
Can you
Eleanor.
copy me on that agenda? Can you forward it to me?
Yeah,
Okay.
it hasn't been posted yet, but I just took what you did, what you gave me and added Eleanor's, and that's it.
All right, if you could copy me, that'd be great.
Yeah, as soon as I get posted, I'm gonna send it to everybody. You're on the automatic Board of Health email. No, you never get left off.
No, I mean, when you send it to Laura Gem, can you copy me?
Yeah,
Yeah, the email that you sent to Laura Gem, you can copy me.
okay.
Okay, sounds good. Thank you.